Growing up, my dad was an orthopedic surgeon. With orthopedic surgery, it was nice because these people would come in and they'd get a surgery and you can see them improve in a pretty short period of time, and I thought that was really gratifying. I am an adult recon fellowship trained surgeon, so I mostly specialize around the hip and knee for surgeries with knee and hip replacements, with emphasis on hip and knee revision as well. In terms of my practice, in terms of hips, I do both an anterior-based approach. It's called the anterior-based muscle sparing approach. I also do a posterior hip approach as well. And the reason why I do both of them is I think it just keeps me not biased between the two. In terms of total knees, I do manual and robotic total knees. Robotics is kind of a newer thing that started, and we've been doing it for the Cleveland Clinic for the last 5 to 10 years. And then for hips, I also do robotic too as well. Most of my patients are usually a little bit older, and they've been dealing with arthritis from multiple causes, whether it's the wear and tear of life that causes them pain, whether it's arthritis from an injury they previously had, and they're usually coming to me usually at a point where they've been worked up and undergone conservative treatment where they're looking for a possible knee replacement or hip replacement. Usually I'll see them 2-3 times before we start talking about major operations and things. There's some people who they have knee pain and arthritis and they're not ready for a surgery, or it's just not something they want to undergo in this time in life because they have other events they want to do. And those are people I follow for a long time and treat them with conservative therapy, whether it's different medications, injection therapy, or just talking to them about different activities that can kind of help them get back to their lives. Whether they're surgical or non-surgical, usually these people kind of follow me for their entire life, which is kind of special. I get to know them, get to see their progress, whether it's through non-operative or operative means, and hopefully, see them get back to the things they enjoy. I played different sports through high school and college and being part of a team. And I think the one unique thing about meeting these people is, you're bonded to them for life when, you do a surgery. So you're kind of a team member with them and making sure they're improving. And then, I'm at home with my wife and my newborn daughter. The one thing I enjoyed growing up was, my dad being around all the time, and something I want to give my child and my wife too.